Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. We're talking today about Gerd, the subject of Gerd.
And that just sounds terrible.
When I told someone that we were doing a show on Gerd, well, what is Gerd?
Gerd stands for gastroesophageal reflux.
Okay, so it's G-E-R-D, and we just say Gerd.
We say Gerd is the easiest way instead of saying gastroesophageal reflux. It doesn't quite have the same thing. Gerd just kind of like, ugh.
Yeah, Gerd doesn't sound pretty.
No.
And it's not.
Yeah, and if you think about what that means, is the word kind of self-explains it. Uh-huh. So your stomach, gastro, is what that esophagus. Uh-huh. So your stomach content goes up your esophagus, and it refluxes. It kind of like burps out. Okay.
Were you burping there?
I was, just kind of giving some real illustrations along those lines, just to kind of get that feel of what that feels like.
I was just thinking, you don't burp much.
No.
Okay.
I try to keep my stomach healthy.
Yes, you do. Well, what are the symptoms of Gerd?
Well, it's the heartburn. So you got that burning sensation. That burning sensation is the acid that's going along the esophagus, because you're not supposed to have acid up there.
Okay.
And it can even go all the way up to, I was just talking to a patient who came in for Gerd, and women are more commonly have it than men.
Really?
Yes. Women.
Why is that?
They don't have quite the stomach musculature that men do, so that it's much easier. Oh, and pregnancy kind of ruins a lot of things in your body, and there's kind of a pushing up on the stomach.
But it's all worth it.
Yeah, that's what you keep saying.
It is.
Yeah, I know. But women are more likely to get it than men. But 30% of everyone gets Gerd in America. So it's a very common type of problem.
So when do you know you have Gerd?
Oh, well, I was still explaining the symptoms.
Okay. I'll let you do that.
All right. But it comes up, and she was I sent her in to get her scoped, because of their symptoms.
Yes.
And they went down, and she had lesions on her larynx and her esophagus. So it had gone all the way up to the vocal cords, the burning on the hydrochloric acid, and then all along the esophagus.
And you said it affected
burns.
her vocal cords, too?
All the way up to the vocal cords, and the vocal cords were damaged.
So does it burn because of the acid?
The acid, what you're doing is you're putting acid up through the esophagus where it's not really supposed to be going. So you get, that's what they talk about, the heartburn. You can have sort of like a feeling of a lump in the throat. You can get the bile or hydrochloric acid taste up in your mouth. You can have difficulty swallowing because you've damaged the larynx. And then you can sometimes, it's not as bad if you got it during the day, but if you start getting it at night, then you can really get into some problems. So it could be worse at night, and that's more advanced Gerd. That's when you don't have things in your stomach, but you're still having the hydrochloric acid coming up.
Okay.
So it's coming up at a continual type of basis.
And why is it worse? Why is Gerd worse at nighttime?
Well, it's more dangerous because it can not only, one, you're not up, you're laying down, so it goes up higher. It can set in the esophagus longer, and then it can also go into the lungs and start to burn the lungs. And then you can start to have, it could become a lot more dangerous at that point.
Yeah. So this is a serious problem. You said 30%
yes,
of all people? Okay.
Serious problem.
So what are the main causes of Gerd?
Well, there is a lot of different speculations, but just, and there's a lot of things that can kick it off. But what happens is your stomach, you have a sphincter, lower esophageal sphincter, that keeps the stomach content from going back up into the esophagus. So it's supposed to be a one-way trip down and then not be able to come back up. But the sphincter can become weakened through a lot of things. It can be nutrition. It could be injury. One of the things that kicks off that's very common is something called a hiatal hernia. That's where your stomach goes up through the diaphragm. And when it goes up through the diaphragm, then it can have sort of a bulge there, and it can squeeze the stomach and cause it to the contents to go through the sphincter. And then the sphincter is supposed to be below the diaphragm, not above the diaphragm. If it's above the diaphragm, then it stretches out. It's like you've got the end of a balloon, and there's a little constriction on that. And if you bring it up and put pressure on it, then that opening actually opens and kind of stretches out. So hiatal hernias are a big cause of that. Also, one of the things that we find is gallbladder disease, cholecystitis, inflammation in the gallbladder, and bile material can go over into the stomach. And if it does that, in other words, if you're getting things that aren't supposed to be in the different places, so if you get bile over in the stomach goes into spasm. And then you start to get the hydrochloric and some of the bile coming up into the esophagus, and then you start to get some burning because it's not supposed to be there. So things are getting into the wrong place at the wrong time, and things don't work well when that
going
happens.
in the wrong direction.
Going in the wrong direction. It's supposed to be going down, not up.
So you're saying the hiatal hernia
is one of the things that really kicks that off. If you have and that's one of the reasons women have a more likely chance of having it, because they don't have as big of a muscle of a diaphragm as men. So, and then also pregnancy has a tendency to push the stomach up because there's room and can kind of open up that little diaphragmatic opening that the esophagus goes through.
Does it help to strengthen that diaphragm?
It does. It does.
We do that through the deep breathing.
Yeah. If you have shallow breathing, where you're not using your diaphragm muscle and keeping that strengthened up. So if you're not using it, you start to lose it, and the diaphragm starts to become weaker, and then it's much easier to develop the hiatal hernia.
Yeah, and I know you adjust the hiatal hernia, and we're going to talk about treatment.
Sure.
Not yet, but is GERD dangerous?
GERD is dangerous. We talked about one thing, if that gets into the lungs, it can kick off infections and other issues, but also the burning in through the esophagus can cause something called Barrett's esophagitis, where it destroys the cell lining, and then the cells that grow in place are not the same. There's more smaller cells. They're not the strong epithelial cells. The esophagus should develop, and that can develop into esophageal cancer. So it is something that
hearing more and more about.
Right, that can develop into a cancer, and also if it's coming up at night, it can cause some lung disease.
So when should a person seek medical help with GERD?
You should start to seek medical help when you start to have this on a continual basis. Now, there are over-the-counter types of medicines that you can do to control it, but one of the things is oftentimes they can make it worse. So it can solve the symptoms immediately, but actually make it worse long-term. So if it's a continual type of thing, you should go on ahead and seek some help. So if you have more than 3 times a week, and then if you have it for longer than 6 weeks, you should seek professional help.
That seems like a long time. Yeah.
Yeah. If that goes on, then you're going to need some type of help to get that under control, because it's not going to get in other words, it's not going to get better at that point.
You're saying 3 times a week, up to 6 weeks.
Up to 6 weeks. Well, yes. Now, I would probably seek help sooner.
Right.
But then it's according to all the literature, that's when they said, hey, you've got something that is a disease process. It's not a temporary type of thing. It's not something that you ate wrong. This is a continual process that's going to eventually cause some problems, and you need to seek some professional help.
Okay. We come back. More on GERD. You can win a free 60-minute massage and a relaxing spa at the Prather Practice. Each month we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, there was a major study by an insurance company that focused on the healthcare model you use in your office. What were the results of that study?
It actually was quite a seismic finding. I like that term.
Yeah.
Blue Cross Blue Shield of Illinois. It's a Chicago-based health maintenance organization. The group has 600,000 enrolled members. So they took about 10,000 of those and put them in with chiropractors who are trained in the structure-function model. Now, not all chiropractors are trained in the structure-function model. These gentlemen actually got the same type of training that I had. Okay. And they were the primary care physicians. After 5 years, they had startling results. They had a reduction of 60.2% in hospital admissions.
Wow.
They had 59% reduction in hospital days. They had a 62% reduction in outpatient surgeries and procedures, and a remarkable 85% reduction in pharmaceutical costs.
Wow.
This resulted in a total savings in the first 5 years of 40% over all the other primary care physicians.
40%.
40% reduction. If you can imagine that we could reduce our healthcare costs across the board by 40%.
And get those kind of results.
And there were 80% less reactions. There was a reduction in lawsuits. There was a reduction in everything. Plus, the people were much, much healthier and much more satisfied. The interesting thing is that the specialists, the cardiologist, the oncologist, the gastroenterologist, all the specialists, as they were asked to rate the difference in the two different models, they gave the structure-function model as the primary care coming in a 96% satisfaction rating, and they gave the disease model as primary care a 40%. The results are indisputable.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com.
And I'm feeling good.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. Well, we're talking today about Gerd. And Gerd again stands for?
Gastroesophageal reflux.
Okay, GERD. And let's talk about structure function care, which we do at the Prather Practice.
Yeah.
How effective is that for Gerd? that type of care?
Very good. And one of the things that I always like to do is differentiate between disease care and structure function care, so people have a good understanding. When you're dealing with a disease care model for the GERD, you're usually thinking about pharmaceuticals. There are surgical cases that that they do, but everybody says that should be a last resort. But pharmaceutically, it's one of the most popular pharmaceuticals out there. Is
for GERD?
Yeah.
Oh.
In other words, it's a really big seller, and people make pharmaceutical companies make a ton of money, billions off.
I haven't seen that commercial yet for the pharmaceuticals for GERD.
Well, when you're talking about
TV.
GERD, you're talking about Tagamet, Pepcid, and Zantac. Those types of drugs are very, very common along those lines, and those are huge sellers. So what they do is they advertise for for heartburn. Okay. So, but yes, they are very big sellers. And disease care, what you're trying to do is to help with the symptoms. The idea on taking a pharmaceutical for the GERD is you want to get it under control, because what they do is they suppress the hydrochloric acid production. And when you suppress the hydrochloric acid production, it gives hopefully your esophagus a chance to heal, so the ulcers are cleared up. And then you go off of it, and then the GERD doesn't continue, and then you get better. So that's the idea behind it. However, you can't stay on those very long, because they damage the stomach over a period of time. And over a period of time makes it, there's more damage to the stomach than there was before, and you get more GERD. So it helps with the symptoms, but makes the problem worse. So when what we're trying to do with structure function care is you try to get to the underlying cause. So with disease care, you're not interested in the cause. You're interested in getting the symptoms under control for a short period of time, so that you can heal up and hopefully just get over it. So that's the disease care model with GERD. With the structure function, what we're doing is we're trying to find out why the GERD has occurred in the first place, solve the problem so that you don't have the issue. One of the things that is very true, if I was to take the pharmaceuticals and I have absolutely no GERD, and took it for 6 weeks, and then tried to, well, actually, if I took it longer than 6 weeks, 6 weeks is about the max you should ever take any of those pharmaceuticals. That's it. After that, it starts to cause damage. And if I took it for like 3 months and tried to go off of any of those medicines, even though I'd never had a problem before, I would have GERD.
So it doesn't sound like that is a good permanent solution. Right.
Now, you can do pharmaceuticals over the counter and then also prescription. And if it's a temporary problem and you're good, then great. But you're only supposed to be on a pharmaceutical for 4 to 6 weeks. And then after that, you are supposed to be off of it, because the benefit, the problems outweigh the benefits at that point.
Okay.
So what we do with structure function is we actually try to fix the problem and get to the root of the cause.
Okay, well, let's talk about what foods should be avoided with GERD.
And one of the things that you want to do is you want to eat an early dinner, because you do not want to be eating late, because, again, when you're laying down, it makes it much, much worse. So you should at least eat about 5 or 6. If you're going, about 4 hours before you go to bed. So that's
about
one of the
4
big
hours
things,
before you go to bed.
Now, the things that kick up GERD is alcohol, chocolate, coffee, and especially decaffeinated coffee. Fatty meals, and the reason fatty meals are a big problem is because it stimulates the gallbladder. Remember, the gallbladder is one of the things that can kick off GERD. So fatty meals, milk, orange juice, spicy foods also is something that stimulates GERD. And all those things stimulate the gallbladder. So one of the things we oftentimes find with people is high bilirubin levels in their blood test. That's a sign that they have some gallbladder issues. And getting the gallbladder solved oftentimes solves the GERD. Sugar, tea, tomatoes and tomato products. And then you want to also avoid carbonated drinks. And then the big thing with the sugar is, I always love to talk about fiber, and fiber is the good guys. So high fiber diet actually helps GERD out a lot.
Yeah.
Low sugar, high fiber.
That. Yeah.
Right. And so those are the big things, the foods that you want to avoid with GERD.
Okay. So what foods help with GERD symptoms?
Big things with GERD is, again, what I talked about was fiber. Mm-hmm. And then some of the other things that are really good along those lines is cabbage and green vegetables. Mm-hmm. Cabbage has the highest concentrate of something we call vitamin U.
Vitamin U? Never heard of
U.
vitamin U.
I know. Methylmethionine is also another name for that, and that's something that they sell in tablets. But cabbage is basically the root of that.
So that's the vitamin U.
That's the vitamin U. So cabbage is excellent for healing up GERD and healing up the stomach. Mm-hmm. So that's one of the big things that you're looking for on that to kind of get that under control. Also, one thing that has been shown to help that out is the juice of potatoes. So a juiced potato actually also is something that helps out with GERD. And the best way to take cabbage is to have cabbage juice. And they found that cabbage juice, if you drink that down, that the healing rate on the cabbage juice was every bit, actually a little bit better than any of the healing ongoing on the pharmaceuticals. Mm. So excellent
Juicing,
type of product.
Yeah, cabbage.
So and if people don't want to do that, we do also sell pills and supplements. And have some supplements that also we do it for you. In other words, more concentrated form.
We have concentrated cabbage.
Yes, yes. So that's one of the big things along those lines, and then licorice.
I like licorice. Yeah.
Licorice has been shown to be one of the best types of products.
You're talking about black licorice?
Black licorice. Uh-huh. So licorice is one of the very best things that you should take. And one of the things that you should avoid at all costs, that I really want to emphasize, is peppermint and spearmint.
To avoid them?
To avoid them. If you have GERD, now one of the things is that if you don't have GERD and you take peppermint and spearmint, it kind of settles the stomach.
Right.
But if you do have GERD and you took peppermint or spearmint, it kicks it up really, really badly.
Oh, interesting.
So no peppermint, no spearmint. That's like a big, big no-no. Mm-hmm. And then licorice root. Now, one of the things that you have to watch out for with licorice root is it lowers potassium levels. So you can get too low of potassium if you take too much licorice root. But they do have a form of licorice root that has that portion out of it. They shorten it to DGL, and it's glycerinic acid is removed. Mm-hmm. So it's been taken out of it. And with that, in which we sell in the office quite a bit for our GERD patients with really, really good results, is we get that into their system, and that helps out. And then the other thing is actually stomach.
Stomach what?
Stomach. Eating stomach.
Eating stomach. Oh, from an animal?
Yes. Not a human.
Right.
But we have glandular stomach. Is one thing that we sell, and to understand what goes on, the hydrochloric acid is made by a cell in the stomach called the parietal cells, and the parietal cells actually make two different things. They make the hydrochloric acid, Well, they actually make a couple of things. They make the hydrochloric acid, and then they also make the mucus lining in the stomach. So no one really has too much acid in their stomach. What happens is the parietal cells have been damaged, and the mucus lining in the stomach has gone down, and so the feeling of the hydrochloric acid starts to become an issue for the stomach. So the same thing that makes the protection also makes the hydrochloric acid. So if you damage the parietal cells, then that's one of the things that kicks up GERD. So if you take glandular stomach into, which we sell at our office, because most people aren't going to eat stomach.
Is it called that, though? Stomach?
Yeah. We actually call it stomach, and it's glandular stomach, and it goes in there and it heals up the parietal cells. And as it does that, then you get a full relief on your entire health.
Okay. When we come back, let's talk more about the treatment. Let's talk about herbals and vitamins when we come back. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
And I realize that's the only time as an adult that I feel like a little kid, is when I go to the doctor. You didn't do what I told you, did you? No, I didn't. What should you have done? I should have listened when you were talking to me. What are you going to do from now on? Pay attention when you say things. When are you going to start? I'm going to start right now. Immediately.
Detailed lab tests are crucial to understanding your health. As Dr. Prather always says, if you don't test, you don't know. There are certain lab tests that all of us should have at least once per year. At the Prather Practice, we recommend 3 affordable tests that provide the blueprint to your health. The Prather Profile is the most comprehensive blood analysis available, providing more information about the function of your body than any other test. Minerals are the common deficiencies in the body, and hair analysis is the most effective way to analyze mineral levels. The bowels have the largest influence on the immune system, and the best way to test that is through the GI Effects Stool Kit. The Prather Profile Blood Analysis and the GI Effects Stool Kit are even covered by most insurances. Don't guess when it comes to your health. Discover the blueprint to your health at the Prather Practice by calling us at 317-848-8048. That's 317-848-8048. The Prather Practice. Restore. And you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. Well, we're talking today about GERD. And very interesting. We've not done a show previously on this, but finding it very interesting. So we're talking about the structure-function approach to treatment of GERD, and we're talking about foods to avoid and foods that help. Let's talk about herbals. What herbals are helpful for GERD?
We had talked about licorice root, how helpful that was, and in the form of the DGL, where we have it. We've taken out the portion that lowers the potassium level.
Right.
So that's a really great way. But one of my favorites is bilberry.
Bilberry.
Bilberry. It has been shown to increase the gastric mucus without raising up the hydrochloric acid. So one of the things as you heal up the parietal cells, sometimes you can get the hydrochloric acid healing quicker than the mucus lining of the stomach. But bilberry seems to really to stimulate the stomach, the parietal cells, to really kick up the mucosal lining, which is really, really good. And the results are really quite amazing that they've been able to see. It's probably one of the very best things that you can take to get GERD under control and actually get to the root of the problem and actually heal it. So,
and a lot
bilberry.
of things we're talking about, we carry at the office.
Correct.
In our natural pharmacy.
So bilberry is fantastic. Papaya. You can eat that or put that into a supplement form, and that is
Papaya is good.
Very, very excellent along those lines. Aloe vera has also been proven to be extremely helpful. So one of the things we have is different forms of aloe vera that you can take. Now, aloe vera in a pure form can cause diarrhea. So we have a modified aloe vera that doesn't cause diarrhea. So, but if you're constipated,
Good to know.
We have super aloe, which actually is a very concentrated
The
aloe
super
that
aloe.
really makes you go. It works better than almost anything in the entire world on making you go. But we also have one that doesn't. That's very good for healing up GERD. Catnip. You can take that in a herbal tea, but very, very good for GERD. Fennel is also excellent for GERD. Ginger, marshmallow roots, and then apple cider vinegar.
We've been hearing a lot about that.
Yes, and that can give you some immediate relief. So if you're having an attack of GERD, instead of popping a Tums or Alka-Seltzer or something like that, you can just take some apple cider vinegar, and you can get some immediate relief that way.
Is it best just to take that straight?
Well, you can, but it's only like a tablespoon, so you don't need very much.
Okay.
But you can put that tablespoon in some type of a liquid and take it down. Especially water is very helpful.
Okay. Great. So we've talked about herbals. What about vitamins? What vitamins are helpful for GERD?
Vitamins have been shown to be very, very important for GERD. And vitamin deficiencies are one of the things that can kick off GERD. Some of the vitamins that are known to be low in people with GERD is vitamin A, vitamin B6, vitamin C, and vitamin E.
Those are the ones that people are low on.
Low
that
on.
have GERD. Okay.
Vitamin U, which we talked about, is something that is also low. And then also glutathione. One of the things that really kicks up GERD is free radical pathology. Free radicals are when the oxidative process is going on, and then you got free electrons that hit. So free radicals can kick up cardiovascular disease, also cancer. It's very well linked to that, but it's also very well linked to GERD, because the free radicals damage the parietal cells, which causes a shift in how the stomach is actually working. And the parietal cells are very sensitive to free radicals. So the vitamin A, vitamin C, vitamin E, and the glutathione work directly on the free radicals and can get some very good results. Some of the minerals that are involved with the GERD. Bismuth is absolutely excellent. One of the things is that GERD can be kicked off by bacterial infections. Campylobacter, Heliobacter are some of the bacterial infections that can be underlying cause along those lines, and we can do tests for that. So we can do tests to see if you have that. And so bismuth, you've heard of Pepto-Bismol? The whole idea behind Pepto-Bismol was for GERD, and they added the bismuth was one of the things that they added into it. And so the bismuth on that is to kill the Heliobacter and Campylobacter. It's one of the best things for that.
And it's pink.
And then the other things that can be important along those lines are some of the other minerals. Calcium, magnesium, and zinc can really play a very big role. If you are low on those, then that can actually kick it up, especially zinc. Zinc deficiencies, the parietal cells are extremely dependent upon zinc, the high levels of zinc to function. And if you go low on zinc, which is the most common mineral that you go low on, then the parietal cells stop functioning as well, and then you start to get a decrease in the mucus lining. So getting the zinc levels up is probably one of the more common nutritional things that we do, and for GERD, and find some really, really good results along those lines.
Interesting.
And then the calcium, if you use a calcium carbonate, that's what they put in the Pepto-Bismol. You can get, it works better than any of the over-the-counter medicines. So calcium carbonate is really what you, along with some apple cider vinegar, if you combine those two, you can get much, much better temporary relief than if you were taking some over-the-counter medicines without any negative side effects. So those are all the good things.
Yeah, that's important, without the side effects.
Right. And then the fatty acids, omega-3 and omega-6, are also shown to be extremely important.
Well, what about, what role does food allergies play in GERD?
Food allergies. Every structure function office should be testing for food allergies for GERD, because that can be an underlying issue. And if you can identify what the food allergies, that puts a much less stress on the gut, on the stomach, because the stomach will react if you're allergic to it, and really has been for many of our patients one of the big factors on getting GERD under control.
So we're talking about structure function care, more of a natural approach. Also, I know in chiropractic adjustments, you're able to adjust that hiatal hernia.
Yes.
So how does chiropractic adjustments help GERD?
First off, as you said, there is almost every chiropractor has learned how to adjust a hiatal hernia. And we are really good at that. And we got a lot of people who come in and say, my GERD's acting up. I need you to drop my hiatal hernia down. Because I can feel it up. Most people can actually, once they get used to it, can tell when it's popped up.
Yes.
And so we do the adjustment on that, and people go, oh, I feel so much better.
Relief.
And just a big relief. And then as you can drop that down, then you can really get quite a bit. But then also, there are the cervical spine and the thoracic spine also can go into a misalignment and cause damage to some of the nerves going to the stomach, which can kick up a GERD symptoms. I've had a patient who came in and their vagus nerve was under stress. And they were also having heart palpitations, and they actually came into our office for heart palpitations. And then we were talking to them, and they also had GERD symptoms. So we did a neurological test on them and found out that their vagus nerve was under extreme stress. So I did a check on their neck, and extreme pain. You know, that's not why they came in. Well, they came into a chiropractor for heart palpitations and talked about the GERD, but they didn't think there was anything that could be done for the neck. So we checked that, saw that there was a real problem, did the adjustment, and immediately they said, one, they could tell a big difference, but immediately they said, wow, I can feel a difference in my heartburn.
Interesting. And that's in the cervical, the neck, and the upper back.
Atlas specifically has the biggest effect on the vagus nerve, and if the vagus nerve isn't working right, then the stomach isn't going to work right. Also the heart, there were several things that were being affected.
Right.
So looking at the nervous system, one of the things that we talk about chiropractic and the importance of chiropractic is that chiropractic isn't the bones. Everybody says, well, you're fixing the bones. No, we're actually fixing the nervous system.
Right.
And the nervous system controls everything, so you have to make sure that your nervous system is working correctly, and that could be a big factor in the GERD.
Okay. We come back. More on GERD. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, what makes your approach and emphasis on the thyroid unique?
We look at it structure functionally, where homeostasis is what is important. And homeostasis is a balance, and there's a balance in the thyroid that should be achieved, which you can determine. And the people who have a normally balanced thyroid homeostasis is probably less than 1%.
Wow.
Of the population. There are two systems that control the rest of the body, the nervous system and then also the endocrine system. And as I tell the patients, those are the two things that we need to get fixed first. You have to have a proper functioning nervous system and a proper functioning endocrine system to be healthy. And the thyroid is sort of the workhorse of the endocrine system. And many of the problems that we see in patients once we get the thyroid balanced out, a lot of the issues start to clear up. The people who come in here, often 80% of them have had because they felt that their thyroid was a problem.
Had them checked.
Had them checked, and they were told that they were normal when...
Why is that?
They're not doing the proper blood tests. They're not reading them correctly. Doctors aren't being specific enough on what the thyroid number should be. The American Thyroid Association has said that the numbers need to be much, much tighter than what they are. There's a different type of evaluation. There's reference range, and then there's homeostasis. What is a perfect homeostasis? The labs aren't there to tell you what the blood work should be. They're just saying, of the people who come in here, 50% of them have this number. Reference range has nothing to do with where you should be.
Right.
That's
I know
not
you
what
look
it's designed.
way beyond them, and we tell people, and they come in, well, my doctor said, this was normal. And
I say, no, that's not normal. I even find endocrinologists not reading lab tests properly to really understand where that should be, because when we get people into homeostasis range, their symptoms go away. That's where they go, oh, wow, I feel really great. All the different things that I was complaining about are all of a sudden now working properly, and that's because they are in the range that I tell them that they should be in.
Right.
Because those are the proper ranges that need to be there.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
It's a beautiful day. Sky falls, you feel like it's a beautiful day. So let it get away.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. Well, we're talking about Gerd today, and Gerd stands for, again?
Gastroesophageal reflux.
That's a test.
Yes.
I like Gerd. I like saying that.
I know. It's kind of an interesting...
And it's much more than burping, right?
Yes, it is.
So we were talking about the structure-function approach that we use at the Prather Practice, and what we do for Gerd and help. And so we were talking about how chiropractic adjustments help. Let's talk about what role acupuncture plays in helping Gerd.
That is a real big key area. We had several patients who we were having, that really was the acupuncture that they could tell immediately the difference on the Gerd. And so one, they could tell that night that they didn't have the reflux at all right after the acupuncture, and when they had that scoped again, get a scope to see how it's doing, really got the healing up. So some people with the acupuncture, you can get some really amazing results with Gerd, and people ask, well, how does that work? How does acupuncture work? And acupuncture works through the electromagnetic energy of the body. And the electromagnetic energy is involved in healing. So if you would have a cut and you put acupuncture needles around it, the cut will heal twice as fast and without a scar. And you can even have a old surgical scar or injury scar. And it could be there 20 years, and you can put needles in it and the scar will disappear.
Wow.
So what acupuncture does is you can hit different points and stimulate a healing that it would normally not occur. and we can direct it to anything in the internal area. Matter of fact, acupuncture has been proved to be more effective for infertility than even IVF treatments, in vitro fertilization, for pregnancy. So it's an excellent tool to really speed up healing and to improve the symptoms of the body. And for GERD, it's one of the things that have been proven to be extremely effective.
And I know we've helped many a woman get pregnant using acupuncture.
Acupuncture, that's a good way. Yeah, good to add that in.
Well, let's talk about diathermy. In fact, there was a patient this week came into our office because of our show on gallbladder.
Right.
And started diathermy. I think she had even just one treatment.
One treatment.
With the diathermy unit. Tell us more about that, because she's had some great results after that first treatment.
She was having some pains, and we were putting her on some supplements, and it takes a while for that to work, and she was needing some immediate relief. So we recommended diathermy for her, put her on that, and after she got done one, she felt immediately better, but then also she passed a whole bunch of gallstones.
Wow. Yeah. And that treatment's $40.
Right. Very, very effective, and something that we use quite a bit for our GERD patients. And people really say, wow, that makes an amazing difference.
And how does the diathermy work again?
The diathermy works through magnets, and it increases blood flow and lymphatic flow. And anything that works better along those lines, then it really, really helps along those that. So what it does is it gets the liver detoxing because it increases circulation, and it also helps to get the gallbladder because the gallbladder opens up and relaxes with the magnets, and then it helps to push that through. And so healing, increase in function, all those types of things are absolutely wonderful with the diathermy. People just swear by it.
Yeah, I love doing my diathermy.
I actually, if I start to get some a little bit of liver tenderness, I get right on that diathermy, because I need to get that detox and get that moving.
Yeah, and it opens up that congestion. Well, let's talk about lifestyle changes that help GERD symptoms.
One of the things is that you need to lose weight. People who are obese are much, much more likely to have GERD issues. So getting your weight down is extremely important for that. Quit smoking. Smoking is one of the things that can kick up GERD because of the free radical pathology. Remember we talked about that?
Right, so that increases the free radicals.
Exactly. So smoking is a real big no-no. Really, if you have GERD, if you cut out all alcohol, you're much, much better off. Matter of fact, a lot of too much alcohol lowers many of the vitamins and minerals in the body, which are exactly in correlation to developing GERD. Lowers your vitamin A, it lowers your vitamin B6, it lowers your vitamin C, it lowers your glutathione, it increases your free radicals. So alcohol can be a real big issue along those lines. So getting that under control. One of the things is how you sleep. So some of the things that you can do is lay down on your left side.
Left side.
Instead of on your back. That helps a lot of people with GERD issues.
Why is that?
Because of where your stomach is. It keeps it from popping back up. So it helps to drain and keep the contents of your stomach instead of up towards the top, down towards the bottom.
So you're saying that's sleeping on your left side.
And
I know when I was pregnant, I hear this from pregnant women, they do better on their left side. I wonder if that's part of it.
That is exactly one of the big reasons, because it takes the pressure off the stomach. And then the other thing is you might have to sleep on an inclined bed. So that would be another thing that you need to do. Exercise. Exercise is a very important part. If you can get some regular exercise, that helps everything to work better.
Right.
So getting your daily exercise, doing your aerobic exercise, your anaerobic,
Well, and I'm
really cuts
sure
down on GERD.
poor posture because you're pushing down on that diaphragm and
Exactly. One of the whole things with the forward head tilt, just getting in that position, you can feel that puts more pressure on the stomach.
right.
You want to wear looser clothing. You don't want real tight clothes right around there. That can actually that can kick that up too.
So no more girdles.
Yeah, girdles are really bad for GERD. Yeah, you knew exactly what I was
Girdles and
thinking. Yes, girdles and GERDs go together.
Well, let's talk about diagnostic tests. What diagnostic tests should be done for GERD?
Well, a good thorough blood test to find out if we have some liver problems, some issues along those lines, gallbladder. Those show up all in the blood test so that we know where we should be concentrating on. Because the blood tests can show all that up. Stool kit is also excellent along those lines, where we find out on the GI, because that shows up how you're absorbing your food, tells us if you have too high of fatty material, then your gallbladder's not working correctly. It shows up. We can even tell how your hydrochloric acid is, and how your pancreas is working. All those types of things can influence that. So blood work, GI stool kit, hair analysis is important because it shows up the minerals and how they're balancing out into the system. So that is a very important aspect of checking. And then also we send out people to the GI specialist because we want to get in and to have them go down the throat, find out exactly what's going on, and see if the esophagus is actually doing okay and how far the burning has occurred. Also getting a sample, make sure there's no Barrett's that's developing. So the
What is
normal, the Barrett's, that's the abnormal cells in the esophagus.
Okay.
It could be precancerous. So checking to see if that's going on. So the normal diagnostics along those lines, along with the structure function diagnostics, making sure that we've got all that under control. You also might need to do some neurological checks. One of the things that we can have some indications is if the vagus nerve is an issue. We can test on that, find out, and then get that under control. You also might need to do some tests to find out if you have some bacterial infections in the stomach. So the H. pylori and the Campylobacter tests can also be very important tests too.
So GERD is not something, it's something to take seriously.
Yes. One of the things that you can develop is if the stomach's not working correctly, then that can create food allergies, which can lead to autoimmune diseases. And then also you can start to develop some pernicious anemia over long term.
Really?
Yes.
Okay.
Which is something that can lead to a lot of health issues, including cancer and cardiovascular disease.
Right.
So we need to, in other words, you're not supposed to be kicking up bile and hydrochloric acid into your esophagus.
Okay.
And you need to take care of it.
So Dr. Prather, we have about 30 seconds. I want to just make sure you get to say how you want to wrap up on this GERD.
Certainly. Most people don't seek help for the GERD. There is answers. And when people have tried, there hasn't really been some good answers, but there are. So seeking a good structure function doctor for your GERD and get some answers and get that fixed.
Okay. Very informative. I learned more about GERD
than you ever wanted to know.
Yeah.
Thank you, Lisa. I
Thank
appreciate
you.
it.
The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.